So we want to thank everybody here for being with us today. We are excited to have you as we learn a little bit more from some subject matter experts on different learning styles and practical solutions. Before we get in there, I'm gonna launch a poll real quick. We're just a little bit curious about those of you who are with us today. So if you take a quick look at all of the different kinds of programs or roles that you may have, and select the one that is most closely identified with your position at your institution. Are we in the classroom? Are we program directors, administrators of those programs? What really fits? We're just kind of trying to see a little bit more about you, who's with us today. We'll just leave this open for a little bit. We got just over half of you here. We're going to be doing a few polls, so get used to it. We like to have engagement in these webinars and conversations, and it's great to hear also just directly from you. I'm going to close this poll down unless somebody else would like to add in. Excellent. So it does look like for the majority of folks with us today are either classroom educators working directly with learners or program directors and coordinators. We have a few of the other folks as well. Happy to have you here. So we're really excited to launch into our content today. I'd like to start. I'm going to go ahead and share my face here. I'm your host today, everyone. Hello, my name is Laura. I'll be hosting and kind of running the general functionality of our webinar, but I'd like to introduce you with our main presenters. So with us today, we have Dr. Sherry Gillis and Kelly Cobb. Dr. Gillis brings a wealth of experience to today's webinar. Sherry's extensive background in nursing and allied health education and clinical simulation has her positioned as a leader in developing and implementing personalized teaching methodologies. In her current role, Sherry is committed to identifying and catering to diverse learning needs, ensuring that every student thrives. It's really our goal. Her innovative strategies focus on differentiated instruction, individualized assessments, and creating supportive learning environments to promote participation. Sherry, would love to say, would you say hi to the group with us today, Sherry?
Hello, thank you for having me here.
We're so excited to have you. We also have Kelly Cobb. Kelly is NHA's implementation specialist and is an experienced educator with a diverse background as a hospital educator, CTE instructor, and currently a nursing instructor. As our implementation specialist here at the National Health Career Association, Kelly excels in tailoring teaching strategies to meet diverse learner needs. So today she's going to share some practical approaches for identifying and addressing various learning preferences, leveraging her extensive experience to enhance the learner engagement and success. So we want to thank you both. Kelly, would you like to say hi to everyone?
Sure. I'm so happy to be here today. This is my very favorite subject. As we have to tailor our teaching approaches with our clients, our patients, so do we need to do that with our students. So I hope you all will really get a lot out of today's webinar.
Super excited about it. Thank you. All right, well, let's go ahead and give you kind of the breakdown of our general topics today. So we're going to be covering these general topics, as hopefully you saw when you were registering for today's webinar. I'm going to ask another quick question. So taking a look at what we're addressing today, and again, just to hear from you, what are you most hoping to learn from our webinar today? And these are just some kind of covering, again, the general topics that we're going to cover, but just curious, what was really the reason why you decided to join across these different concepts? So give you guys some time. Take a look. Let's see. All right, just about half, just over half. Right now, it looks like engaging learners across different styles is in the lead, but tailoring to learning styles to impact success is creeping up on them. Does anybody else want to add in their thoughts there? All right, we're going to go ahead and ways to support my new instructors in the classroom. I see that in the chat. Thank you, Amanda. Awesome. Well, let's go ahead and close that down. So it looks like engaging learners across different styles is just slightly ahead of tailoring to impact success, but we did have everybody, every column was selected. So we're excited to hear that and excited to dive in on today's material. So I'm going to go ahead and turn this over to Kelly and team. So Kelly, let's take it away. And you are on mute. There we go.
It always helps when you go off of mute. Okay, so the first thing that we're going to be talking about is our topics that we're going to cover today. And I am so sorry, but I am actually not seeing the screen. Here we
Oh,
go.
okay.
Oh, okay. So if we can go back to the previous slide.
Yeah.
Okay. So we had looked at what we're going to cover are specifically how is teaching different for adult learners, or for those of you in the career and technology space, the emerging adult learners, visual, auditory, and kinesthetic. Some of these are preferences, and some of these are strategies whereby, you know, depending upon what you're teaching, these strategies just fit better with these particular approaches. And then we'll also cover group learning. So our next slide, when we talk about adult learners, what is different about them is that they really need to see relevance of the information for not only how it's going to help their future patients that they're taking care of, but their own professional development. Why are we learning what we're learning? So scenario-based learning really helps those adults in seeing meaning and making the emotional connection. When you can utilize relevance plus emotion, that's our sweet spot to really helping make that content memorable with lasting results. So you guys tell me, when you get this question, why is this important? Do we need to know this? Is this important? If you guys can answer this question, I'm sure you're all familiar with the pain scale. Do you become extremely frustrated, very moderately, somewhat, slightly, or not at all?
Right. We try to bring that poll a little bit home with that pain scale, right? With that familiarity. So we've got the majority of folks, and I think, Kelly, you might actually be surprised by the outcome. I'm going to go ahead and close this down if anybody wants to add in their thoughts here. All right, so it looks like I'm going to share these results, but the majority of folks were not that frustrated when they ask. I would think I would be irritated, but I'd love to hear, Kelly, what your thoughts are.
Well, I've certainly become, irritated before when asked, why is this important? Why are we covering this? Particularly when it's asked after we've covered the content. However, really, I'm not upset when people ask me, is this important? What do I need to know in relation to this content? Because really, that's why they're coming to us. I know, often the way many of us were taught, we were taught that everything was important. And anymore, the students are much more, they advocate for themselves much more. And, I personally think that that's an important question. That's why they're coming to us, the experts, to learn and help them know what is important. And so I think it's a very good question. So moving on, we're going to talk about then what is relevance. Generally is 5 different things. One is believable. 2, the content that they're learning would actually help improve patient outcomes and decrease patient harm. Furthermore, it's something that they're going to be doing frequently, and they may not have time to look it up. They're going to need to know this urgently. Oh, my colleague Diego asked, his favorite question is this going to be on the test? And you know what? That's actually a really good question too, because we really shouldn't be testing how we're not teaching, right? Or vice versa. I think you hear the term, oh, teaching to the test, but in all actuality, we should test what we're teaching. I think a lot of people would agree.
I
Uh,
think the relevance of the question is whenever you read through all of this, that answers that question is, why do I need to learn this? Why do I need to know this to improve patient outcomes and decrease harm?
right. So here's an exercise in relevance that you might consider doing. And you could do this as a ticket to class. So here's an example of we've got a module over professional responsibilities. And at the beginning of every module, every chapter, you see learner objectives. And here's an example of learner objectives from this particular module. Um, Understand steps to gain basic life support certification, HIPAA regulations, medical terminology, chain of command, and therapeutic communication. So, what I might do with my learners is before class, have them fill this out. It's a very simple, not too time intensive, but it gets them to thinking. What are we going to talk about and why is it important? So, list 2 examples of how knowing content from these particular objectives would improve patient outcomes. 2 examples that if you did not know it could potentially cause harm. 2 examples of items that would be performed frequently and 2 that would be performed urgently. So next I'll show you an example of how that might be filled out. So we'll look at first, improve patient outcomes. So BLS certification, obviously, we know that's we hope it saves lives. Okay. Next would be therapeutic communication. That's going to help better engage our patients, develop trust, rapport, and guidance. Then potential harm, not adhering to HIPAA. Oh my goodness. Well, for one, everybody could get sued and you could get wrote up and fired. But, furthermore, it could cause harm to the client. They could have medical identity theft. Another example would be inappropriate medical terminology that would lead to miscommunication, potentially misdiagnosis, mistreatment. Next, what are some tasks that would be performed frequently? We're going to always adhere to HIPAA. Use appropriate medical terminology. We're going to document care provided, communicating with our colleagues, explaining diagnoses and treatments to clients in a way that they can understand it. And then urgency. We're going to want to do CPR urgently. And observing chain of command, reporting critical changes, adverse reactions, or medical errors quickly ensures timely intervention. So that's a real quick, achievable thing that can be done. Now, sometimes I have struggled with what is important, my own self. So let me show you something that can help you with that. How do we know what is important? Something that you can do that really helps is one, look at your test plan and preferably one that's based off of a job task analysis. So this is an example of our test plan at NHA for our pharmacy tech. And you can kind of see here, you've got overview of laws. That's about 25% of the exam. That's important. Drugs and drug therapy, that's important, 15%. But the most important is the dispensing process. That's almost 45% of the exam. So then another example would be, here's our medical assistant. You can see there's foundational knowledge, anatomy and physiology, and then direct clinical care. You can see that that's almost 60% of the exam. And that's what industry says is most important.
Kelly, may I ask a question?
Mhm.
That just because, so anatomy and physiology, we know is only 5% of the test, but a foundational building block of understanding the medical assisting practice. So, if I'm your student and I say, yeah, but I only need to know 5% to pass the exam, but we know that having a strong foundation in A&P makes everything else that much stronger. How would you address that with a potential student?
Sure. So, you've it goes back to, as you said, the foundation. You've got to be able to understand the foundation in order to know how to apply it. So, a good example would be, there are multiple examples, but for instance, you would need to understand skin to most appreciate infection control, right? You would need to understand cardiorespiratory systems in order to most understand the vital signs that you're taking and why and what that means, or your EKG interpretations. And so it can be a little bit misleading when it says 5%. Really, what that means is there will be 5% of questions that are related to A&P, even pathophysiology content that is not situated to clinical care. But there certainly are questions that are very much A&P like questions, but they are situated to direct clinical care.
That makes so much sense. Thank you.
Uh-huh. And then I think I included one more example. I
Oh, no,
guess.
just those two.
Okay. So now we're going to go into some of those learning preferences that we talked about: visual learner, tactile learner, auditory, etc. So there are some things out there where people can do self-assessments. A lot of them will also, self-report. I prefer to learn hands-on, or, I prefer listening to my lectures. But there are some things online where people can do self-assessments. And we all like learning about ourselves, right? Um, and you can also pick up on some of these preferences through simple classroom observation. And we'll be providing you with some examples of that.
I like to give these links to my students at the very beginning of the semester to help them understand how best they learn and to develop those studying techniques that'll help them throughout the program. So these are very useful.
I think that's such a good idea because often we've been studying in such a way that is not helpful. So the more insight we can get into ourselves, right, and empower the students, is going to help them. All righty. So next, we'll talk about visual learners. So some characteristics that you may find with visual learners is they prefer to visualize concepts. They really like diagrams, charts, graphs, and you might notice that they take very detailed notes, and they typically will either write in and or highlight different topics, different colors. And in particular, they may struggle with verbal instructions. They also, in addition to being told verbally, they also want a handout with detailed steps. Some personal characteristics that you might see is that they tend to dress trendy. Their clothes match, and they often will pick up small details that other people will miss. And they tend to be able to make connections. They like to organize content, and they enjoy the what of learning. So some classroom techniques that you can do are labeling. They also have anatomy coloring, and that's good for your hands-on learners as well. They like to organize. And Dr. Gillis we were talking about this beforehand, and an example might be highlighting everything cardio or underlining it in red. or highlighting it in pink. And Dr. Gillis, did you say pulmonary? We said blue,
Yeah,
right?
pulmonary was blue, hematology was red. So I've noticed that these students like to highlight in their book with a certain color, and then they'll go over to their notes and they'll tab their notes with the same color that they highlighted in their book. So that just a way of organizing their thoughts, and so that whenever they recall the information on the exam, they can literally see that information in their head in red or blue or yellow or whatever it is.
Right. I've also seen them for the renal system highlight in yellow.
Right.
Yeah. And so they like to look at similarities and differences. So they really like those charts where you might be studying, let's say, osteoarthritis, rheumatoid arthritis, and osteoporosis. They'll put all three of those in a column and list what items are similar and what makes them different. So next we'll look at some examples. This is an example of labeling and color coding where they have colored the word a particular color, designated color, and then colored that structure that same color. And as Dr. Gillis said, they often will do this just in note taking as well. And it's a good strategy if they don't know about it to help them. And then next is an example of a concept map. This is a diabetes. And you can formulate these yourself on the board where you're getting this information from your students. But something that I have done is I've taken a picture just like that concept map and I've put it on PowerPoint and then covered it up, each of the sections with a different color. Then I give them a legal piece of paper and I have them create this themselves. And so what you're going to do is you will animate those shapes on exit. And this lets them know this is a different topic that we're covering. And also you've got this much more to fill out. So don't take up all the space.
I love these concept maps because it develops not only the visual learner, but also those critical thinking skills. And I've even placed these and cut them up for our tactile learners and had them put them back together like puzzle pieces.
It's a great idea. I think it looks like I'm this is my kind of learning. And I would have loved that. So in school, have done that for me. Yeah, absolutely.
So next then is our auditory learners. And, you know, we think of auditory learners as they like to listen. They like to listen to the recorded lectures. They like to listen to podcasts. But guess what else they like? They like to talk too. And so they like to interpret meanings. So we talked about the visual learners kind of prefer the what of learning. The auditory learners, they really gravitate towards the why of learning. Why is this important? And they like to talk about it. They like the scenarios. They like to contextualize content, and they like the repetition and the discussions, you know, rephrasing things and thinking about it different ways. So they really like that scenario based learning, situating it to the practice environment. So, okay, we've learned about phlebotomy and, you know, all the steps that we need to do in obtaining a blood specimen through venipuncture. Now, let's talk about how would this be different if you had a client that was dehydrated? How would it be different if you had a fragile skin? How would it be different for a 4-year-old? And some of their personal characteristics are they like to participate. They often are influential with their teammates, and again, they enjoy speaking and listening to. Alrighty. So as I said, something that's really good for them is rephrasing. An example would be, here are the steps in the book, but now how would you rephrase this for a person with sixth grade health literacy level, which is the level that most Americans have in relation to healthcare? Why? Because they're not taking A&P classes, and they're not in biology and what have you. Okay, and then our next one, some examples that you can do is incorporate those audio recordings. Also, if you have good podcasts that you like folks to listen to, you could also have them complete assignments by letting them create video responses. They really like mnemonics, they like the rhyming. And another thing, and Laura actually made this suggestion to me, when you have someone who is English second language, and honestly, if you use those strategies with all learners, it actually is beneficial for them. And that is to use the audio play feature that are in your online modules. They may be reading, but then listening at the same time. And then, of course, offer opportunities where they can have those discussions and study.
One of the things that we like to do in the classroom is we offer debates. And so in our fundamentals classroom, we debate, is nursing an art or is it a science? So what is the art of nursing and what is the science of nursing? And we get a really good discussion with these students about that, and they really learn a lot from each other.
Oh, and there's so many good discussions you can have about patient autonomy too. What would you do if a 15-year-old came to the clinic and wanted care that they didn't want their parent to know about? Or likewise, what if you had a compromised client who was cognitively compromised, and it had power of attorney, medical power of attorney with another family member? That family member doesn't want them to know what their diagnosis is. There are just so many things. Yeah. Somebody said this is great for neurodivergent learners. Yes. So this is an example of a mnemonic. There are so many online that you can search for. This is a blood sugar one: hot and dry, sugar's high, cold and clammy, need some candy. I can remember thinking the same mnemonic when I was having questions about insulin and diabetes. But you can also have them come up with their own. And I know Dr. Gillis has done that, where she's had students make their own mnemonics, but she's also had them make their own drug commercials when they were studying pharmacology.
Yeah, so that really plays to many different learning styles where we have them look up and research their medications. Of course, we assign them medications and we have them look up and research it, and they make videos for commercials like you would see on the television or whatever. And then they play back those videos for other students to listen to. And they'll make up their own mnemonics in there. And it's just a great way of bringing in all of those different learning styles into one activity.
So here's an example. We talked about the case studies or scenario-based learning. So this is an example that you could do, is you could have the students complete some type of pre-work before class. You might try doing that objective, learner objective ticket to class. There's any number of things, but I would not have them do just a really big project, but something that's brief, and they've been able to look at maybe the steps of the procedure and turn that in before class. So Then what you would want to do is introduce a case study and then give instructions to the entire class. So we're all going to talk about this client, and as a group, as a class, you may come up with, let's make up a patient who would have to have this particular procedure, or who has this particular disease process. So then what you would want to do is divide your students up into small groups. What I frequently do is I'll say, hey, everybody pay attention to your number. 1, 2, 3, 4. 1, 2, your number, hey, you're number 3. And so all the ones get together, all the twos get together, threes, etc. And so present scene 1 with question 1 to the entire class, and then give each of the groups a short amount of time to discuss that question and scenario and come up with their answer in consensus, then converge back as a group. You can also do this online with breakouts, and then have them answer that question, and then proceed with the following unfolding scenes. And then what you would really want to do too, this is going to help you see the gaps in their understanding before they take their test. Then I would highly encourage that you incorporate that content into your test. That way they see the benefit of having done the active learning. So next is an example of how you might do that. So here's scene 1. We have a little lady who's come in. She's frail. She's got to have a blood draw, and she's anxious and expresses concern. So here's going to be the first question. What is the priority? And so you would have them break out in their groups and consider these questions here, and consider what they believe to be the most important and why. I hope this is resonating with everybody, that you would discuss it, you would be able to go over the rationales, and then go on to your next scene and rinse and repeat. Okay, so the next slide shows the following scenes and how you might do that. So do you guys see how easy this would be with just, 4 questions?
Yeah, we're getting some love in the chat. Absolutely.
Yay! All righty, we'll go to our next slide. And I'm going to let Dr. Gillis take this over. She really shines with all of these, but she is really great with coming up with tactile, hands-on activities.
So this really is my favorite type of learner. These learners learn best by actually going in and doing the activities. They prefer hands-on things. They prefer real-world application. So they're the ones that are going to be at the bedside, actively working through problems. They like projects, simulations, they're role-playing, such as giving them scenarios, and they have to come up with ideas to work through those scenarios. They really, though, struggle with passive learning. They don't like sitting in the chairs and just listening to lectures. They want to be in there. They want to be actually doing it. And that's what makes them such a great type of learner. They tend to be active and enjoy those physical activities like sports and gardening. So you can bring in those ideas to the classroom and incorporate those into their learning styles. They are really good at problem solving. They are the ones that are thinking outside of the box. They're the ones that are helping other students implement that problem solving and critical thinking. They usually enjoy demonstrating tasks, and they are open to volunteering. They're the first ones that are going to raise their hands and volunteer for anything that comes up. They enjoy the how of learning. How do we get things done? How do we ensure that we're giving good patient care?
And I want to interject. I remember having a student one time, or actually it was a group, and they had come up, they were talking about blood pressure in relate. So this just made me think of the gardening scenario. They were talking about blood pressure, and they gave the example of how high blood pressure was similar to watering your garden with too high of a pressure on your hose, and that it would not only damage the flowers and the vegetables, but then the water also wouldn't sink into the flower bed. I thought that was such a good example.
That is a great analogy on how high blood pressure can damage other organs and other processes in the body just by the force of the blood. It's a great example.
Well, and they even put their finger over they said if you put your finger over the hose, the opening, that would be like a blood vessel that is narrow because of plaque. They really did a great job of comparing something in the real world and everyday activities to what's happening inside our bodies.
That is definitely out of the box thinking.
Yes.
So these learners learn best by providing hands-on activities and projects in the classroom. And like I said, we can take those concept maps that Kelly introduced earlier, we can cut them up, make them into puzzle pieces to where they're actually having to fit the pieces together. This is also good for those visual learners because then they can see how things connect. They utilize simulation and role playing and active participation. They're the ones that are going to be playing out the scenarios while other students are watching and giving feedback. So like the example here, you can have one student acting and performing a skill and giving an instruction while the other student is the client, and that client has to provide verbal understanding of the instructions that each student gives them. And then they actually have to act out and return demonstration that that first student had taught them. You can incorporate computer-based learning activities, concept-based learning projects, encourage students to create physical models or displays of content. For this, I had to teach fetal anomalies for our students, and I had them take clay or Play-Doh to where they actually had to mold out the fetal anomaly. Let's say the baby was born with the intestines outside of the stomach. So they would mold into clay what that would look like. And so then they had that visual and hands-on representation of that anomaly. We can provide opportunities for clinical practice and real-world application. This is going into the skills lab and working through scenarios at the bedside with each other. What if I have a patient who is contracted and we can't extend their arm? How am I going to take that blood pressure? And then work through that with the students. Okay, Kelly, this is you.
Yeah, so this is just an example of a skills checklist. So this is something that we have with our products and our skills builders, where I really like the concept of, honestly, Sherry, what you just talked about, which was the see one, do one, teach one, right? And this is what allows them, if they've got they may record themselves doing these skills. I know, Sherry, I think you've had students do that with uh, all
Yeah,
types of skills, but you've had them do that even with like administering IM injections and
we
that type
have
of thing.
them, I'm sorry, we have them record all of their skills so that one, they actually are practicing their skills before they come in for checkoffs, and two, so they can visualize each skill step by step and see where maybe they went wrong and self-correct.
And I would imagine that gives them so much confidence to them when they actually have to come in and quote unquote check off.
Yeah.
And I really like these. What I'll do sometimes is if I'm also using a video is I'm gonna stop, at certain sections and say, okay, now you find your neighbor's brachial pulse, and why is it important that we would do that, etc. So we can go to the next slide.
So again, video demonstrations of the procedures or techniques. We actually have televisions in our skills labs to where students can watch the video. And just like you said, Kelly, we'll pause the video and say, okay, now let's do this part of the skill and follow along for those skills on the video and then actually doing it at the bedside. Hands-on projects they complete at home using household items. During COVID, of course, we had to go to online learning. We had students, they had to do Foley checkoffs, and so they used water bottles or Coke bottles or whatever they had at home to show or demonstrate the steps that they would need to do that checkoff. And of course, they did upload those as an assignment. During that learning activities online, we had virtual breakout rooms so that then they could have group discussions. We would give them case scenarios, and as a group, they would work through those scenarios and then come together and discuss each one of those scenarios. We encourage movement, getting up, walking around, when completing tasks and assignments. Again, they don't like to sit still. They don't want to sit there and listen to a lecture. And then they like to be self-paced. So some of these students may be able to master skills faster than others. And so they don't want to sit on something if they've already mastered it.
We're going to take a quick poll here. We know we've had some really great content. You guys are getting a lot of love in the chat, but just take a minute and think back about when you were a student and now as an instructor, and how you personally feel about group projects. Right, group projects cannot be everybody's cup of tea. So we're going to just launch a quick poll here. Where did you fall? Where are you now when it comes to group projects, would you say, right? Were you, yes, these are great, I love them. Group projects, right? I understand why they're important, but they're not my favorite. Where are you with your understanding of group projects? Yeah, let's take a quick minute. Got almost everybody. Does everybody else have anything they want to add here? Okay. It's really interesting because just like we've been looking at with these different learning styles, it's hard to gauge the percentage of the population that are the different learning styles. So just like that, group projects are the same way. I'm going to share this. Look, we have 3 of the 4 options. We're identical in how many of you felt that way, right? I think that's really fascinating. Kelly, you had a reason you wanted to ask this question, so I'm gonna turn that back over to you.
Sure. So we're going to go into, we talked about in the very beginning that we were going to talk about adult learners, what's important to them. Then we were going to talk about strategies with visual, auditory, kinesthetic, hands-on. And now let's go into group learners. And, the thing, we all know that in practice, we're going to have to work together, right? They're going to be working with their peers. And how do we do that? The way that we do that is providing them opportunity to do it when they're with us. Then we also know that it's going to prepare them for, student engagement and ownership of their learning themselves. And additionally, group learning is really nice because you're able to cover a lot of content in a shorter amount of time. So typically, if you tell students, hey, we've got a group project to do, they're, oh no. So we're going to give you some examples of group learning that hopefully will kind of help you all and encourage them to want to do those things. So group learners, they prefer collaborative settings. They benefit from group discussion and team-based projects. They really value interpersonal communication and competence. I know we've got a product called Personability, and they've got 5 modules, and one of those specifically is teamwork, because a lot of people need help with that. They enjoy participating as a group member. They appreciate delineated roles. And they sometimes will be a little bit non-budging about those roles. They're good at delegating and organizing. Often they can be good with conflict resolution. They enjoy brainstorming, generating new ideas, but they may have low tolerance for those who do not participate and contribute. They're going to be the ones who come up to you after there's been a group project for your class to do, who they're going to come up and tell you so-and-so didn't do their part.
I think there's a valuable lesson in that too. They need to know how to work with others, even through diversity. And so even if that is a problem, I think there's value in learning in that too.
You're right, through that conflict resolution.
Mhm.
You know, when are we going to learn how to do that at work, or is it preferable to do it, in a controlled, safe learning environment? They may sacrifice for the benefit of others. So they may do their part and everybody else's part too. But eventually, this can then sometimes lead to resentment, burnout, and those that loved group learning now never want to do a group project again. Okay. So next are some examples of group learning, or some of the things that we kind of already talked about, doing some of those problem solving through scenario-based learning in small groups, and then coming back and discussing that as a larger group. So some things that you can do, an example, if you're doing online work, you can post a question, and then before students can see an answer, they've got to um, provide their own answer. Then make it a 2-part where you've got to provide an answer, and you also have to give genuine feedback to at least one peer, and then ask a question of another peer. So 3 things here: answer question. After they answer that question, they can then see everybody's feedback. They need to give positive feedback, and then ask at least one question. So hopefully you can see how this would generate a lot of discussion. And they literally have to rely upon their peers to ask them questions in order to complete those tasks. So here's an example of a team-based project where it would be a case study. And so you may ask them, this goes back to relevancy also, where we're going to create a scenario of a client, and we're going to ask these questions. Based upon this scenario, what is your greatest concern for the client? What do you think is the client's greatest strength? What is the most likely complication they should anticipate? What are early symptoms of that complication? What are most common diagnostics and most common treatments? And then finally, what teaching would you provide to that client?
This,
So,
I'll say this is such a good example of factors that can create debate amongst the students because not everybody's going to give the same answer. And it doesn't mean that their answer is wrong. It just means that they think differently than somebody else, which might help other people in the classroom too.
Yeah, and I really like the most common, most likely, early, etc. This takes them to another level of learning because if you were to ask, what are the risk factors? What are the complications? What are the symptoms? What are the diagnostics, etc.? They're going to list everything.
Mm-hmm.
And that does not help them determine then relevancy. So this is going to, your adult learner likes to learn this way because they like relevance, but ultimately it's going to help them be more engaged and ultimately more prepared for real life practice as well. So there's more thinking involved when you have to consider, hey, I've got 10 things listed here, but what is probably the most common? You get really good discussion in that way. So next is an example of that, where we've got this gentleman. His scenario is that, he's a little bit older. He's come in to see his primary care provider. He's tired, he's dizzy, he gets short of breath. And reviewing the history, they noticed that he's got a diagnosis of hypertension. And today, when I took his vital signs, he had bradycardia. He had a heart rate of 45. Oh my goodness. So you might have students answer all of these questions. Maybe this could be your pre-work, right? Your ticket to class. Or you could divide them up into groups where this group has got greatest concern, greatest strengths. This group has got risk factors, etc. I hope you guys like this, but you can see how some groups might be smaller or larger than others, depending upon on the topics they're assigned. So another example of group topics you might do is, for instance, vital signs. You might give one group heart rate, one group respirations. Then you could take that a step further into abnormal vital signs. What is the most common cause of bradycardia? Well, for that gentleman, it's probably his blood pressure medication. He's probably on a beta blocker. Anti-infectives. What's the difference between an antibiotic and an antiviral?
This would be
Medication.
great to give multiple groups the same thing and then have them compare their lists.
Yes. And then if you're doing that backwards planning and you've already selected your test questions based upon those relevancy items, when they work through these, you can make sure that you're covering that content and clearing up any misunderstandings that they're having. So this is an example of same type of thing. This is a skill. So you can see here on this scenario, we're going to make up this client story. Let's do SBAR. Here's the situation. She's a little elderly lady who's come into the hospital. She needs help walking. Her background is that here she is in the emergency department. She's dehydrated. She's a little bit confused and she's unsteady. So you could give a certain group description of the skill, reason for the procedure, expected outcomes, steps you need to take beforehand. You could have another group do actions to take during procedure. What are some of the most likely complications? Actions you should take if that complication happens, and client education. This is an example of how you would do that. We've been doing clinical focus, but how about billing and coding? Let's say that we have a client come in and they are here for a doctor's visit, and here's the scenario. Come in, they're 45-year-old for a routine physical exam. After the exam, it's discovered that they have high blood pressure and they're given a beta blocker. So then you need to code and bill this visit correctly. So you could have 4 groups and ask one group, what is the CPT code for a routine physical exam? What's the ICD 910 or the ICD 10 code for the diagnosis? What is the appropriate PCS code for the prescribed medication? And then you could ask another group, what is the difference between copay and coinsurance? I hope this is resonating and you guys can see how you could potentially scale these type of activities with group learning. So it kind of moves you away from being the sage on the stage and having to lecture, come up with ways to, get them to memorize content, to then moving you to that position of guide on the side where they're actually doing the work and you're clearing up misunderstandings. You're facilitating a classroom that's conducive to learning. So this is an example of patient care tech. They could do role play with those patient care scenarios, utilize mannequins, medical assistant, practice injections, vital sign measurement, create visual aids.
I know we're running right up on time, but we'd love to do just a quick recap. And then Kelly, Dr. Gillis, if there haven't been any questions that have come in, so I'd love to just go ahead. And for those of you who are with us, we're going to post in the chat those survey links I mentioned right in the beginning. Remember, there are 2 here, but we're going to wrap up. So please stick with us if you can. But we've got a survey on today's content and then also kind of a form about you. And filling these out will put you into 2 different raffles. You should see those populating in the chat here in just a second. But Kelly, Dr. Gillis, I'd love for you to just, if the group could walk away with just a couple of key components from the amazing material you've provided today, what would you want them to be kind of the primary topics that they retain?
I would say situating learning to the care environment is the most important thing you can do, and solving for relevancy. And I think the best way that you can do that is through case studies and scenario-based learning, and then offering opportunities for some of these active learning strategies.
I agree, Kelly. I think for me, it would be that the understanding that not every student learns the exact same way, but you can reach multiple students by doing simple active learning strategies in the classroom to situate that scenarios or those topics to the bedside.
Wonderful. Well, we'd like to, again, we just posted the links in the chat. Please open those up if you can and fill those out for us so you can be put into those raffles. And we want to thank everybody for being here today, especially our amazing presenters, Kelly Cobb and Dr. Gillis. Thank you for this incredible content. There was a lot of love in the chat on what you were sharing today. And we're going to stick around and we have some time for some open questions. So there aren't any that have been posted. So please, if you do have questions, now is the time. But other than that, we do, from all of us here at NHA, we want to thank you for being here, for your time today, and watch for the recording in your inbox in the next week. But thank you again.
Thank you, everyone. We super enjoyed it.